Diabetes, exactly. So exercise caution in patients with diabetes.
Sorry, Rishma, why is that? Like,
Because they will act sort of increase in cell synthesis, gluconeogenesis. It acts on the liver and enhances gluconeogenesis. Another thing that can happen with steroids, one of the common side effects of steroids is Cushing's syndrome. Have you heard of this?
Yeah. Don't know what it is, but I think we believe.
Cushing's syndrome. Increased steroids in the body. Either you're giving it externally or somehow, for some reason, your adrenal gland produces the most steroids, will give you Cushing's syndrome. Now, what happens in Cushing's syndrome? There is fat deposition. That's why you get fat. Fat deposition, mainly where? Around facial area and truncal.
Does that mean what's truncal?
Puffy face and around trunk.
Is this a contraindication or a side effect?
It is a side effect, and obviously patients with Cushing's syndrome, you won't give steroids, so it fits into both. What else will happen with Cushing's syndrome? It causes thinning of the skin. Okay, it causes thinning of the skin and decreased collagen, as a result of which there will be increased bleeding tendencies.
Rishna, can you please just explain again, like, why does it happen? Like, why is the fat deposited when you're on corticosteroids?
Because again, sweetheart, please remember corticosteroids are anabolic hormones. What do you mean by anabolic? Remember, people like athletes do steroid abuse, and why do they do steroid abuse? To put on muscle mass and to gain weight. Because they're anabolic hormones, they are responsible for synthesis of fats. And where do these excess fat go? They will get deposited.
Got you.
Okay?
And then with the thinning of the skin,
Thinning of the skin is because of decreased collagen.
and why does the corticosteroid cause that?
Because it causes decreased collagen synthesis, and collagen is responsible for integrity of your skin and your blood vessels.
Right. Okay.
Another thing that is going to happen with Cushing's is, anybody?
Sorry, I just still don't get it. The collagen,
Yeah.
if it's an anabolic hormone, it's to do with the synthesis of fat.
Synthesis of fat, yeah.
But is there a relationship between
Because
the
collagen synthesis happens from your inflammatory cells, and it is anti-inflammatory.
Okay.
So it is decreasing
Thank you.
collagen
Sorry, I just
synthesis.
needed that little link.
Oh,
That
yeah,
is right.
same. Yeah.
Okay? So fat deposition and decreased collagen. All Cushing syndrome patients are going to be hyperglycemic. Again, because it causes increased blood sugar levels.
So with the increased bleeding tendencies,
Yeah.
does that mean you wouldn't want to give it to an anemic patient, or would it make them?
Not in an anemic patient. Anemia doesn't mean you're going to bleed. But I will be very careful if I'm giving it to a hemophiliac, because they already have high tendency to bleed. Do I make sense?
Yeah.
In other scenario, another side effect and a contraindication possible is steroids. Long-term steroid administration is associated with osteoporosis.
What kind of long-term? What count as long-term?
What's very good question. Anything more than 6 months is long-term. Osteoporosis. Now, what is the difference? You need to understand these two terms: osteoporosis and osteomalacia. Have you heard of this? What's the difference? No? No, not osteomalacia. Okay, now what's the difference between them? That's my beautiful bone. That's the bone. That's the second bone. A bone has collagen fibers woven into it. Yes?
Yeah.
and on those collagen woven fibers you have calcium and phosphate deposition. Yes? Yes? Loss of minerals from the bone. Loss of calcium or phosphate from the bone is osteomalacia. So can I say vitamin D deficiency can lead to osteomalacia? Yes. Because vitamin D is responsible for absorption of calcium from your gut. So if no calcium from the gut, no deposition in the bone. Does that make sense? So osteomalacia is demineralization of bone. So you're losing minerals from the bone is osteomalacia. What is osteoporosis? Loss of bone matrix. What is bone matrix? It's nothing but the band of collagen fibers sitting there is bone matrix. Okay, loss of bone matrix is osteoporosis. And did we just discuss that corticosteroids are responsible for decreased collagen synthesis? Yes, that's why decreased collagen synthesis within the bone, decreased bone matrix leading to osteoporosis.
I like these linkages.
Very good. What is the other mechanism by which it causes osteoporosis? Please remember, all our sex hormones are steroid hormones. Estrogen, progesterone, testosterone, all of them are steroid hormones. Okay? Osteoporosis is more common in males or females? Females. After what age? After menopause. Why? What happens suddenly after menopause? The ovarian activity reduces, as a result of which there is decreased estrogen. So do you see, hello, listen. Do you see that there is a link between estrogen and bone matrix too? What is the link? Estrogen is also responsible for laying down bone matrix. And that is why after menopause, when your estrogen reduces, your bone matrix weakening starts happens, and that's why osteoporotic. Clear? Okay, do corticosteroids come into picture here? Corticosteroids, when you're supplying externally, there is too much steroid in the body. So, like I said, the pituitary is just going to get a message, stop steroids. So the pituitary by itself will stop production of ACTH, which in turn will stop the production of steroids from your adrenal gland. And at the same time, the pituitary will also decrease the secretion of FSH and LH. And FSH and LH are responsible for stimulating the reproductive cells for production of estrogen, progesterone, testosterone. Yes? Because there is just general vibe inside the body going, no steroids, that's it, there is just too much in the body. So will that affect natural estrogen in the body? No natural estrogen in the body, osteoporosis. No natural estrogen in the body, can I say there will be menstrual irregularities as well? That's the other side effect. Testicular atrophy as well, because no testosterone in the body as well in males. Hello? Do you understand me?
That's why they tell them not to take them.
That's right.
Wow.
Okay, yeah. You're going to be bulky from outside and empty from inside.